Hey, thank you for coming to my show. I think you'll hear something today that makes you click that like button, share with your people, and subscribe so you don't miss what's next. Let's stay connected. Tell me what you think in the comments. Thank you for joining us here at our Unseen Roots. I'm Lionel Gentle, your host. And today I have Neticia with me. So, how I like to start off all my podcasts is, who are you?
Well, that's a great question. I'm Neticia Waldron. I am a wife, 20 years now, I think, 19, 20 years, a mother of three, and I am a healthcare administrator professionally. I'm a published author. I serve my community. I wouldn't call it an activist, but I definitely look to do work to close gaps in access and um, health equity is really important to me. So um, a lot of my work is just focused on people and how to make our lives better. I am a serial entrepreneur. I own a business called Whole Woman Fitness, where we focus and cater to women's physical, spiritual, mental, and emotional health. And so, really, what my life's work is providing the things that once I needed and now that my community needs. And so, that drives a lot of my passions. A lot of my work is really working to make other people's lives better by utilizing my education to just improve my surroundings, invest in my community so that it can continue to flourish. So,
Yeah, yeah. Who are your role models who inspire your work?
hmm. So I would say initially my work was inspired by when I was about 17 years old. My grandmother, who had a lot of influence in my life, died suddenly of a massive heart attack. I believe she was 2 days before her 60th birthday. I would like to accredit that very impactful happening to my work in healthcare, on top of my mother and her mother were both in healthcare. But I would say that my grandmother inspired me. She carried a lot. She took care of her children and her children's children generationally. Um, Secondarily, I would say like more modern role models or people I model my life after. The late Hecky Powell, he had a lot of influence in my life. And just being an entrepreneur, he mentored me a lot before he passed away. How to prioritize business, how to make good business decisions outside of emotion. I would say, yeah, Hecky Powell was a big, big, impactful influence. And then local hero, Black woman, amazing woman, Robin Ruth Simmons. I have the privilege of being a friend and uh, extended family member. That's a lot of the way that she is driven by passion and bettering our people. Um, I would say that, yeah, those people help me to drive a lot of the decisions I make and I would say are great to model, work, passion, life, ambitions after.
Yeah, yeah, definitely, definitely. The work that Robin is doing is tremendous, and
For sure.
the interesting thing is I don't know if people yet know how impactful her work is has become, and
Mm.
hopefully one day they'll realize it because
Oh, yes.
it's
Yeah.
hitting hard.
Well, yeah, it's usually the necessary work that, like you said, the unseen roots are that you have to dig down first, and so before anything flourishes and comes up through the ground. So I like to think that she's doing that internal work, that we don't necessarily see the benefits of yet, but they're coming.
So true, so true. Share a success story about how your efforts made a tangible difference in someone's life.
Someone's life, or well, I would say a success story. Well, I feel like I have a lot of success stories. One work that I guess, tremendously proud of is I was able to publish my first book before the age of 40. Um, it is a book that shares life experience, my own life experience. It didn't start off green grass and green pastures. I had a very challenging upbringing. And so out of those experiences, I was able to pen a book called Worship and Warfare. That body of work I'm really proud of because it impacted a lot of people. It really inspired people to tell their story, for one, and there are a lot of opportunities there to learn how to make it through adversity, experience the trials of life, and still be triumphant and still manage life by going in and having spiritual victories through God and Christ for me, who gives me strength. And so I am very proud of that work every day. I mean, it's been 3 or 4 years. I'm 42. I wrote it at 39, maybe. I think I published. Um, and still every day there are people, from making it through grief, from making it through um, housing insecurity, from drug addiction in my family and just different experiences, and not being defined by those experiences. Um, I think that that book has the ability to impact many people and has so far. If I can, secondarily, I'll tell you about a work that I'm working on now. It's called Pathways to Wellness. Um, the program is designed to close healthcare gaps and equity gaps um, in underserved communities. So basically, what I do is I specialize in designing programs that close gaps in healthcare by targeting chronic illness, providing preventative services through an app. It's a remote patient monitoring program that allows people who didn't necessarily or couldn't afford access to healthcare or access to quality healthcare to be able to access it and overcome many of the conditions that lead to premature death, and really bring down our community. Statistically, we are more likely to die from diseases due to late reporting or late diagnosis, or because we are not having the preventative care due to social determinants of health. So I work really hard every day. Um, we're working with the city of Evanston and Erie Health and other community organizations to really build out this program so that we can, within the city of Evanston and surrounding areas, help the people that are most impacted by redlining here in the Evanston community. That redlining is written in policy all over this country, and so if we don't do the work to combat it, we'll continue to see the negative impact on our health, on our life, on our mental health, um, for generations, and it's proven to work negatively. And so we're doing the work to reverse and build the very people that were impacted negatively. We are isolating funds to serve them by providing free or no cost access to exercise, fitness, meal plans, nutrition, and where there's an absence of resources for food, providing that. And then if they have chronic illness, really monitoring the disease so that they can begin to have therapeutic behavioral modifications to lead them in the right direction and ultimately shorten that gap, that 13-year um, life expectancy gap. We want to live longer. We want to live healthy. We want to have quality lives. We want to look good. That's just a perk. But
Yeah.
ultimately, if I began to change my health habits and teach my kids, ultimately by that third generation, those kids are living more healthy. And then not only teaching them, providing the resources to be able to succeed, and not necessarily working with what we have left, because if we have to prioritize medication management or over food, guess what's going to happen? If we have to prioritize nutritional foods over paying our bills, guess what's not going to happen? And so we are working tirelessly to, close that gap because we deserve to live long, healthy, and satisfying lives too. So really, really proud of that work as well. I know that was a long answer, but that's
No, no, that's quite all right. That's your answer.
yeah,
This is highlighting the work that you're doing.
yes, sir.
If you could quickly, what's the name of the book again?
Excuse me, Worship and Warfare
Worship
by
and Warfare.
Neticia Waldron. Yes.
Okay, and you can get that on Amazon or anywhere
Yes,
you
it's
find your
available
book.
on Amazon. It
Okay,
is. It
great.
is. And if you catch
Yeah.
me riding down the street, I pop my trunk. I have them there too.
Right on,
I
right
always have them
on.
available. That's right. That's right. You
Yeah,
have
hey,
to,
that's how
be
people get
prepared.
started. Yeah,
Yeah, you
yeah,
have to be prepared to share the work,
yeah.
because there's always somebody that needs, as long as you're adding value to the community, there's reason to live. So I make sure every
Yeah,
day I got a reason to live.
definitely. And secondly, the name of the program was is it? I don't want to butcher it. What's the name of the
Oh,
program
it's
again?
Pathways to Wellness.
Great, thank you.
Pathways
I want to
to
make sure
Wellness.
we have that and
Yep,
get that out. And there's a
for
website for
sure.
that as well. Is that right?
So right now we are working to deepen the website between
Okay,
the city's website and Whole Woman Fitness. There's plenty of
okay,
information available, but I'll just tell you a couple main components of the program. We utilize remote patient monitoring technology, deepen and develop primary care relationships, address healthy food insecurities. We address medication negligence and reduce ER visits, offer appointment reminders, and help people to advocate within the healthcare systems that have already proven to underserve us. Um, we provide low cost fitness. We provide re-education courses, food prep courses, free equipment to the chronically ill, and we collect and track data, clinical data points, so that we can support people and reverse those scores based on what we find. And we improve the overall health of compliant individuals and provide them with a sense of community. A lot of people don't know where to begin. And so we partner people in demographically focused groups so that they're with like-minded individuals with common goals, and make sure that they have a sense of family in the work in the work that they're doing, because this is a life journey and it takes a long time to really start to see the results that we want to see to actually change our lives. So we make sure that people are well supported, and then we're utilizing existing city resources to do it. So
yeah. It's a marathon, not a sprint. You know, what
yeah, that's
unique
right.
perspective? Yeah, yeah. What unique perspective do you bring to your work due to your identity as a Black woman?
Okay, that's a great question. I think my unique perspective is experience.
Mm,
I not only have experienced the tragedy it is to have a loss here just about the 29th of September. My mother's mother went home to be with the Lord. She lost her life due to chronic illness. If you ask me, prematurely at 76 years old.
mm,
Um, like I said, my father's mother to heart disease. My mother is dealing with COPD. It's a chronic condition of the lungs. And so I live it. I also have been intentional to educate myself and gain the skills to change it, to rewrite our history, to rewrite what's coming in our future. And so I think, experiencing the social economic impact, the redlining impact, experiencing health inequities and uh, food insecurity and shelter insecurity. I think that they have given me the experience to understand the social determinants of health, but do something about it from a position of passion, from a position of empathy and concern, and to be well educated. And the Lord has blessed me to be surrounded by a bunch of amazing women who are well educated in this field. And so I work with a team of women who are certified, licensed, and well equipped to do this work well. So I appreciate the the variation of education levels and experiences that exist on my team,
mm.
and we all have a very personal impact, to the Black story and the Black experience and what it has done for us. But we have an equal amount of passion and skill and know how to do something about it. So, we're not remaining in
Yeah,
tragedy. We're not remaining a statistic. We're not remaining a misfortune, but we're changing that. So I think that makes us unique and capable.
yeah. As a Black woman, what is your superpower?
I love that. My superpower is not being afraid. I
Mm,
think that it's really important to approach life head on. Like if you see something going on, deal with it. And I think additionally being willing, sometimes life can kick you down and you don't even have the will to do anything about it. But I'm grateful to still have a pursuit of change. And my other superpower is the Lord God, and lastly, I want to say therapy. I go to
Mm.
therapy. I don't proclaim to, have it all together, but the traumatic experiences that I have gone through, I address them both spiritually and clinically. It's important to be able to have behavioral and cognitive therapy so that we can retell our story in a healthy fashion, cope, have healthy coping habits, be able to make and address decisions not from the position of pain or tragedy, but to be able to do them with a healthy perspective and a healthy outlook on life. So, I definitely want to first give God the glory, but I'm also doing the work. And doing the work is my superpower. I think that historically, right, our parents, they kept everything quiet. They didn't address stuff. You don't talk about what happens in this house. But I think that in a lot of ways that's poisoned us as a people. And so now being able to approach it head on and be bold about it, and this didn't go right, but I'll be darned if it's gonna keep going wrong. So
Yeah,
um I tend to, just come at it head on.
yeah, yeah. What are some I'm sorry, what are some innovative projects or initiatives led by Black women that inspire you?
Hmm. Innovation. I love innovation. I think that it really drives my work day to day because you have to like figure it out. I think I already mentioned um, the work that Robin's doing. Um, Here, I'll tell you one of the another local hero that is working to uh, Black woman that's working us out of a jam right now. A local Lisa Lade. She always amazes me. Kim Holmes, the work that they're doing to impact the community. Kim Holmes is starting out with the young ladies as they, bring children into the world and re-educating them and providing them with resources that they need to actually establish strong families and strong ties in the community and strong careers, knowing, teaching them that coming out of the gate or starting early with parenting, though it's less than ideal, the start, she's setting them up for success in the long run. I really love the work that Kim Holmes is doing with Cradle to Career. It was one of those programs that helped me along when I had my child at just the young age of 19 to finish my high school education, to teach me parenting class, give me parenting skills and coping skills, and then teach those to my child so that he didn't necessarily repeat those bad behaviors that existed in the environment. So I admire that work. Lisa Lade, the work that she's doing in the Haitian American community, really, I think it's called Sisters of Haiti or Daughters of Haiti. They're doing a lot of work to not only funnel resources uh, to the needy families in Haiti, but really remain a strong community, a strong knit community here amongst themselves. It's a smaller population, but they too are providing the resources, the education, the safe space, the mental health space that's needed to really thrive and see our Black people do well. And one of the things about when I started Whole Woman Fitness was we always said that if you strengthen a woman, that a woman will refuel her community. We're just
Mhm.
designed to. We're ingrained um, nurturers. And so that nurturing, like if you nurture me, I'm not going to keep it to myself. So I'm guaranteed to at least impact the four people I live with. And so I love that about uh, the Black woman. We have a unique experience and a lot to carry, but I think we do it with grace. And sometimes, even when it's rough and we're considered hard and less palatable than other communities, I think no one else can understand what we carry. But I think we do it with grace and with beauty. Nobody can deny our excellence and beauty. Um, it's amazing. Some days I wake up and I amaze myself, like I am still going. Yesterday was a rough day. And of course, thank you, God. But like, there's a lot of reasons to give up. And that's just not an option.
Yeah, yeah, it's very true. It's very, very true. How can we better support and amplify the voices of Black women, leaders, and change makers?
That's a great question. I love that. So I think offering whatever support you can. Um, we don't all have the same reach, right? We don't have the same level of influence, but the people that you impact, like be kind to them, offer and extend a hand. Everything doesn't have to cost. Yes, you may have a product that you're working to sell, but sometimes just give it away and sow those seeds that are necessary. And similar to what you're doing now, just extending a platform and an opportunity for someone else. At Whole Woman Fitness, I have 4 other instructors that just started the program with me. They were enrollees and they have since certified and co-teach at Whole Woman Fitness. So I think that giving people an opportunity to fumble in a safe space and learn how to cultivate their gifts among you, drive people, push them, encourage them. Like one thing I say about myself is like, you're not going to be around me and remain mediocre because I'm going to convince you that there's something great inside of you that nobody else can do. So I think that positivity piece and encouraging one another is so important because the world is not going to do it. It's going to tell you you're not enough. It's going to beat you down. It's going to be discouraging. Like we carry so much, but just
Yeah,
being kind and offering those doors, even though my door is small, it's a door that, they didn't have to walk through yesterday. So,
yeah, that's very true. And it goes back to what you said about Kim Holmes, Ross, a
mhm.
little earlier about being that example, extending yourself and helping people.
Yeah.
I'm a proud example of Evanston's cradle to career. My
Okay. Okay.
first 3 episodes over the summer was a part of a grant that I received. So
Nice.
she helped
Nice.
me get started. So I'm well aware of, you
So,
know, Kim
all right.
and so, and Robin and I
Yeah.
believe Lisa, is she the woman that runs the Haitian Day every
Radio.
summer?
Yeah. Uh-huh. And
Yeah. See,
she has a radio show, Viva La Difference.
okay.
Yeah.
Oh, Viva
So,
la de France. She's on that as well.
yes.
Okay,
Yes.
Mr. Man
She was
produced.
a, yep. Mr. Man
Mis-
produces it and she used to host it. So, yeah. She gave
okay,
me
great.
she gave me an opportunity to be on her show when I first launched my book, and so it was great exposure to the community. So
Yeah,
yeah.
nice,
Hmm.
nice. It's wonderful to see the seeds growing that have been planted in the community, to see those
Yeah.
seeds growing. Um, what resources do you wish were more readily available to Black women who want to make a difference?
Um, I would say grants that you don't necessarily have to jump through hoops to get.
Hmm.
Um, One thing that I often find a little bit difficult to access is the resource of space, like opportunity and space to have programming. Because most often, when we're just starting out, our programming has to be free or very inexpensive in order to get people to attend. And so, being able to access beautiful spaces um, at low to no cost so that we can reservice those spaces to the community would be helpful. And I think mentorships are really important and undervalued when you're talking about providing resources to the community. There is nothing new under the sun. There's always somebody who's already done it and probably
Yeah,
done it well. And so it makes no sense to reinvent the wheel. To be able to access people who already have the brilliance, the know-how, the knowledge and understanding of how to do what we're looking to do is always, I think very helpful.
yeah. I'll, and I'm not sure if you're aware, but the Evanston Public Library is a great resource. I
I haven't
use
been
their
in there to
space.
find out. Okay.
I use their space every first Wednesday. At least I did for my first season.
Okay.
And I host a live show every first Wednesday. In fact, April 3rd will be Jessica Cooper. She'll be my guest at the Evanston Public Library. So
Oh,
that's
nice.
that's a great resource, and I don't know how many people are aware of the that resource. It's a very, very powerful resource. It's free.
Oh,
You
yeah.
know, they're,
Absolutely.
they're
I'm
your
gonna be
coordinator.
there.
Yeah, your family coordinators can help you out. So just
Okay.
an FYI to you and everyone
See
else
there.
listening.
See there. Thank you. Thank you.
You're
Noted.
very welcome. You're very welcome. How can men in the Black community be better allies and partners in the work of uplifting and empowering Black women?
To men, I would say, try. I
Mm,
think that sometimes, pardon me, I think Black men experience the most scrutiny than any other individual in the world. Black American men, but Black men, period. Your skin is weaponized, your masculinity is weaponized. But I think that sometimes having that impact can weigh in on your esteem to continue. And so I'd say try again, you know, um, pardon me, in those spaces. Um, a lot of times when I'm in the community spaces and, watching people fight, it's very often Black women who still believe in you, know that we believe in you, and just try again, like outside of your 9 to 5. And yes, you got to get the bag to take care of the house, but make room to dream and, keep trying to do more than what the world says you can do, because it's like more than possible. And it's a whole group of women, a whole community that hasn't given up on you and don't see you as scarred, as poison, as murderers, as lack. But we see the beauty in Black men, and I can see the weight. I can see the weight that it has. That I mean, society has had on Black men, but I just say, don't give up. Don't give up.
okay.
Yeah, we need you.
Yeah, as we need you, as we need
Yeah,
you.
absolutely.
How do you manage the emotional labor and challenges that come from serving your community, or that come with serving your community?
Um, have I would say having common spaces, connecting with people who understand because they're also serving. So being able to have those meltdown sessions and just, be honest about not being okay. I think
Yeah,
it's really important. Not always having to have it together. That's one thing that I've recently realized, the pressures of influence, being able to really just be raw and uncut and unregulated for a time. Society does require that we are palatable. And, I'm not always palatable because it's hard, um, just getting up and carrying what's necessary. Because, like, getting up, going to work, taking care of your family, that's just the start. And so I think getting with other strong Black women who understand, who are doing the work, and just being honest and candid about, the pain, um, and sometimes the loss that comes along with watching our people diminish early. That's a hard reality. Um, but one thing I feel like the enemy does well is make us feel like we're the only one that's going through this. We're the only one that feels like this. We're the only one that feels depressed, or, and making you ashamed, but being like the one that's going to be bold enough to be like, what, I am not straight. I need to just come over your house and cry, or, do you got 10 minutes? I need to swear for like 8 of them, and then you can put me back together for the last 2. And having those spaces, and if you don't have them, find them, be intentional to connect with with other people.
Yeah, that's very important. You're right. You're right.
Yeah.
How do you celebrate your own achievements and contributions as a Black woman making a difference?
Um, I think I do a poor job at celebrating my achievements. I do. Like other than my birthday, and then some years I just don't feel, don't have the energy to really make a big deal out of it. But I think that we've been taught to dumb down or diminish our accomplishments. And so that's something that I probably need to work on. Because one, we've overcome a lot of adversity to just get to come out to baseline, but to be able to accomplish above and beyond the norm, I think it deserves a lot more celebration. But what I have been intentional to do is to celebrate other women. So I think if I surround myself with women that I celebrate, like that in turn would come back around and they learn, they learn to celebrate. I was talking to my therapist about being so baseline about everything. Like, I could win a new car today and be like, "Oh, that was great." But like that's really like the peak of my joy. And like
Yeah,
I want to be the type to like jump and scream. I haven't done that since I was a kid because life has just been a serious situation.
yeah,
So I would like to do a better job at celebrating my accomplishments outside of just going to dinner or, like I want
yeah,
to scream and celebrate like in a phenomenal way. But that requires breaking out of some emotional places and being more vulnerable. I haven't gotten there yet. Pray for me. Yeah, yeah.
Well,
So I'm working on it.
my wife often says, it sucks being adult because there's so many responsibilities and there's
Yeah.
so many things you have to do and so on and so forth. And you're right.
Floss twice a day, shower,
Yeah, yeah,
those just add those things like take your vitamins. Those
yeah,
are already like some extras, but yeah, I think that
yeah,
we have to take time, make time, and be intentional to like really give a big hoorah because like this is a big deal. We're
yeah.
we're a big deal.
Yes, you are. Yes, you are.
Yes, you are. Yeah.
Well, thank you. Thank you. What are your hopes and dreams for the future of the Black community, and how do you see yourself having a role in shaping that future?
That's a great question. I see us as a Black community, because I think that no matter what we go through or how hard the world is on us, I think that we're always willing to share, give, and contribute to others. So I would like to see us as the ones that are providing the help and not the ones
Yeah,
needing it. Um, Helping other people to, you know, pull it out the mud. That's how I see us because I think that we have willing spirits and willing hearts. And so I think if you resource us up, which it's coming, I think that we'll be able to like make a real difference out in the world. So that's what I see for the Black community, being the lenders and not the borrowers, the
yeah,
head and not the tail, above and not beneath. So that's what I see. How can I contribute? How do I see myself contributing? One, just starting with what I know how to do, which I've been professionally trained in health in a healthcare environment. As a healthcare administrator, I can continue to design programs that help our people live longer and realize their potential. Even down to financial literacy. Like if we were more financially literate, the twos and fews that we're able to make it off, I
mm,
imagine that if we were properly resourced and educated, that we will be able to do so much more. So I think re-educating us and providing programming and a community that welcomes it, right? Like a lot of people are at work 9 to 5. They're not rushing at 6 o'clock to go do this. But what if I bring the program to you? What if I made it easier for you to access it online? What if I, you know, just go above and beyond to make sure that you can succeed? Everybody's not going to do it, but being aware of what my community needs and providing it is how I would like to contribute.
yeah, yeah. And that's huge if you can bring it to them and make it the easier you can make it for them, the better.
That's right.
That's
That's right.
huge.
Let me increase your chances of success by taking down some of those barriers that stop you from getting there.
Yeah,
So don't travel. Let me come to you.
yeah,
Go into community spaces that people are always there. Black folks, we historically gather in churches. We're working to get this programming right at church So, like, instead of going home at 12, 1 o'clock, just stay here for another hour and let's work on getting healthy, this week and helping
Yeah.
people see, the value in good health and the value in satisfaction, which means being honest about some of the stories and watching our mothers and grandmothers and grandfathers die prematurely, being honest about that and letting people know that starts with what we're eating. That starts with sitting
Yeah.
on that couch instead of getting up, taking a walk. That starts with not taking your medication once things have gone too far. Let me show you what a cirrhosified liver is. Let me show you what amputation really is and what it feels like and how you don't really bounce back from that. But we're not having enough honest conversations in our communities about how we contribute. It's real easy to blame society and um, its policies. It is.
Mm.
But there are also some things that we can do for ourselves that are practical, easy, and just require a little effort to live a long time and then deciding if we want to live and getting after it.
Yeah. What does liberation look like for Black women?
Liberation. Um, so I don't think liberation is something that can be defined one way. But I do know that it's going to have to be taken. I don't think it's something that somebody's going to give us. But I think liberation means facilitating open and honest discussion without the fear of the backlash, without the fear of consequence, um, being able to face um, the same society that has, I think, intentionally impacted us and being able to not only fit in those spaces, but lead in those spaces, uh, re-educate in those spaces. I think that liberates us when we're not necessarily having to assimilate, but we're controlling the narrative and rewriting our stories in a healthy way. I think that liberates us.
Thanks for watching. I hope you enjoyed the show. Please like, share, and subscribe. Until next time, let's stay connected.